Impaired blood circulation in the pelvic area is a common cause of erectile dysfunction in men over 60. Symptoms such as a sensation of squeezing or discomfort in the groin, reduced erectile function, and vascular weakness may be early signs of vascular issues. These symptoms often reflect underlying endothelial dysfunction, where blood vessels lose their elasticity and ability to dilate effectively. Simple dietary interventions, incorporating foods rich in nitrates, citrulline, and key minerals, can improve blood flow, enhance vascular health, and support erectile function naturally. Beets are a potent source of dietary nitrates, which the body converts into nitric oxide, a critical molecule for vasodilation. Nitric oxide facilitates the relaxation of smooth muscle in blood vessel walls, particularly in the penile arteries, improving blood flow to erectile tissues. After age 60, nitric oxide production naturally declines due to reduced activity of endothelial nitric oxide synthase, leading to symptoms such as sluggish arousal, weaker erections, or a cramping sensation in the groin. These symptoms are often mistaken for normal aging, but are indicative of compromised vascular health. Consuming 1 small glass of beet juice, approximately 150 to 200 milliliters, on an empty stomach in the morning, or incorporating roasted beets into daily meals, can enhance nitric oxide levels, reduce vascular stiffness, and improve penile blood flow. Studies suggest that regular beet consumption may increase nitric oxide levels by up to 20%, significantly aiding circulation within weeks. Watermelon, particularly the white rind, is rich in citrulline, a non-essential amino acid that acts as a natural vasodilator. Citrulline is converted into arginine in the body, which further supports nitric oxide production. This process helps relax penile blood vessels, reducing vascular spasms that cause groin tightness or discomfort during arousal. This tightness, often described as a dull pressure, is a sign of inadequate blood flow to the penile tissue. Blending both the red flesh and white rind of watermelon into a daily smoothie, approximately 300 to 400 grams, can improve erectile strength and alleviate discomfort within 2 to 3 weeks. Unlike pharmaceutical options such as PDE5 inhibitors, citrulline from watermelon supports the body's natural vascular function without side effects like headaches or heart strain. Research indicates that citrulline supplementation can increase penile blood flow by 10 to 15%, offering a safe and effective alternative for men seeking non-invasive solutions. Pumpkin seeds are a nutrient-dense food, providing magnesium, zinc, and arginine, all of which are essential for vascular health and erectile function. Magnesium, approximately 535 milligrams per 100 grams of pumpkin seeds, relaxes blood vessels and prevents spasms that contribute to penile discomfort. Zinc, 7.8 milligrams per 100 grams, is critical for maintaining testosterone levels, which naturally decline with age and can exacerbate erectile dysfunction. Arginine, an amino acid, further supports nitric oxide production, ensuring adequate blood flow to the penile tissue. Consuming 1 tablespoon, about 15 grams, of raw, unsalted pumpkin seeds daily, sprinkled on meals, added to smoothies or eaten as a snack, can reduce groin pressure, improve morning erections, and enhance overall vascular function. Clinical data suggest that regular intake of these nutrients can improve testosterone levels by 5 to 10% and reduce vascular inflammation, supporting long-term erectile health. The combination of beets, watermelon, and pumpkin seeds creates a synergistic effect, amplifying their benefits for vascular health. Beets initiate the process by boosting nitric oxide production, opening blood vessels, and laying the foundation for improved circulation. Watermelon's citrulline enhances this effect by relaxing penile arteries and reducing silent spasms that impair erectile firmness. Pumpkin seeds provide the minerals and amino acids needed to sustain vascular health, supporting testosterone production and preventing vascular constriction. This combination, often referred to as a circulation trifecta, addresses the root causes of erectile dysfunction by improving endothelial function and reducing vascular tension. Regular incorporation of these foods can lead to noticeable improvements in erectile function within weeks, with studies showing up to a 30% improvement in penile blood flow when combined consistently. 7-day action plan. Morning. Drink 1 small glass, 150 to 200 milliliters, of beet juice on an empty stomach to stimulate nitric oxide production and enhance circulation. Mid-morning. Blend a watermelon smoothie, 300 to 400 grams, using both red flesh and white rind to support vasodilation and reduce penile vascular spasms. Afternoon. Consume 1 tablespoon, 15 grams, of raw unsalted pumpkin seeds to deliver magnesium, zinc, and arginine for sustained vascular health. Daily practices. Maintain hydration, 2 to 3 liters of water daily. Engage in light physical activity, e.g., 20 to 30 minutes of walking, and ensure consistency in dietary habits. Additional nutritional considerations. Beyond beets, watermelon, and pumpkin seeds, other foods can further support vascular health. Leafy greens like spinach and arugula, rich in nitrates, can complement beets in boosting nitric oxide. Fatty fish, such as salmon or mackerel, high in omega-3 fatty acids, reduce vascular inflammation and improve endothelial function. Nuts like almonds or walnuts provide additional magnesium and healthy fats, supporting arterial flexibility. Incorporating these foods into a balanced diet enhances the overall effectiveness of the circulation trifecta. For optimal results, avoid excessive consumption of processed foods, refined sugars, and trans fats, which can exacerbate vascular stiffness and inflammation. Lifestyle factors. Diet alone is not sufficient to address erectile dysfunction comprehensively. Regular physical activity, such as brisk walking, cycling, or resistance training, improves cardiovascular health and enhances blood flow. Aim for at least 150 minutes of moderate exercise per week, as recommended by health guidelines. Stress management techniques, such as mindfulness or deep breathing, can reduce cortisol levels, which negatively impact testosterone and vascular health. Adequate sleep, 7 to 8 hours per night, is also critical as it supports hormonal balance and tissue repair. Smoking cessation and moderation of alcohol intake, no more than 1 drink per day, are essential to prevent further vascular damage. Limitations of pharmacological approaches. Medications like PDE5 inhibitors, e.g., Viagra Cialis, provide temporary relief by forcing blood flow to the penis, but do not address underlying vascular issues. These drugs can cause side effects, including headaches, nausea, flushing, and, in some cases, cardiovascular strain. Over time, their effectiveness may diminish as vascular health continues to decline. In contrast, a nutrient-focused approach rebuilds endothelial function and supports long-term vascular health, reducing reliance on medications. Combining dietary interventions with lifestyle changes offers a sustainable, side effect-free strategy for improving erectile function and overall well-being. Monitoring progress. Men adopting this dietary and lifestyle plan should monitor changes in symptoms over 4 to 8 weeks. Improvements may include stronger erections, reduced groin discomfort, and increased energy levels. Keeping a journal to track dietary adherence, exercise, and symptom changes can help assess progress. Regular checkups with a urologist or healthcare provider are recommended to evaluate vascular health and testosterone levels, particularly if symptoms persist. Blood tests can measure nitric oxide metabolites, testosterone, and inflammatory markers to provide objective data on improvements, long-term benefits. Beyond improving erectile function, the dietary and lifestyle strategies outlined here support overall cardiovascular health, reducing the risk of conditions like hypertension, atherosclerosis, and heart disease, which are closely linked to erectile dysfunction. Enhanced blood flow also benefits other organ systems, improving energy, cognitive function, and physical stamina. By addressing vascular health proactively, men can maintain vitality and quality of life well into their later years. Conclusion: erectile dysfunction in men over 60 is often a symptom of impaired vascular health, but it is not an inevitable consequence of aging. By incorporating beets, watermelon, and pumpkin seeds into a daily routine, men can naturally enhance nitric oxide production, relax penile blood vessels, and support testosterone levels. Combined with hydration, exercise, and stress management, this approach addresses the root causes of erectile dysfunction, offering a sustainable alternative to pharmacological interventions. Consistency in these habits can lead to noticeable improvements in erectile function, reduced discomfort, and enhanced overall health within weeks, empowering men to maintain vitality and confidence.